Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will cover a very important topic, Mohs Microscopic Surgery of the Integumentary System. I will briefly explain the Mohs procedure and how to quickly choose codes based on stage and blocks. So let's get started and make this concept easy to understand. Mohs micrographic surgery is a technique for the removal of a complex or ill-defined skin cancer with histologic examination of 100% of the surgical margins. Let's go through the basic steps of performing Mohs surgery so we can understand the procedure. In stage 1, the surgeon removes the visible cancer along with the thin layer of additional tissue. The removed tissue is cut into sections known as blocks. The tissue is then frozen and the blocks are placed on slides and stand for the examination under the microscope. The surgeon microscopically examines the slides. If no residual cancer is found, the procedure is completed in one step. If residual cancer is detected, the process is repeated in stage 2, 3, 4, or more than 4, with as many blocks as necessary until no residual tumor remains microscopically. When practicing for most surgery codes, it is important to highlight key points that will assist you. For instance, most surgery codes should be reported when the physician acts as both pathologist and surgeon. Additionally, how to code repair biopsy when done on the same day as most surgery and when we have to use the modifier 59. Most surgery codes are based on anatomic site, stage, and number of blocks. The primary codes correspond to anatomic site and the first stage, allowing up to 5 tissue blocks. Add-on codes are for additional stages or blocks. While coding for most surgery procedure, we have to follow some coding guidelines. In most microscopic surgery, the physician acts as both pathologist and surgeon. If either of these responsibilities is delegated to another physician or other qualified healthcare professional who reports the service separately, these codes should not be reported. If repair is performed, use separate repair, flap, or graft codes. If a biopsy of a suspected skin cancer is performed on the same day as Mohs surgery because there is no prior pathological confirmation of the diagnosis, then report diagnostic skin biopsy and frozen section pathology with modifier 59. Let's start our practice question to reinforce your understanding of this concept we have covered. Dr. John, a dermatologist specializing in Mohs, completed surgery on Howard's right thigh for an ill-defined skin cancer. Dr. John is acting as both the surgeon and the pathologist for this surgery. The surgery consisted of 9 excise specimens prepared and examined during stage 1. Additionally, a total of 7 excise specimens were prepared and examined during stage 2. How would you code Dr. John's services? Option A with the service code 17,311, 17,312 into 6. Option B with the service code 17,313, 17,314 into 6. Option C with the service code 17,313, 17,314, 17,315 into 6. Option D with the service code 17,311, 17,312, 17,315. The first step is to determine the type of the procedure performed. In the given scenario, Mohs surgery on the right thigh consisted of 9 excise specimens prepared and examined during stage 1 and 7 excise specimens during stage 2. First, we will eliminate option based on the anatomic side. Since the Mohs surgery was performed on the thigh, we will eliminate option A and option D. After eliminating option A and D based on anatomic side, we also eliminate option B because each stage of the Mohs surgery has more than 5 blocks. So we need to code 17,315 for each additional block. Option C with the code 17,313 is for Mohs micrographic technique on the thigh. It represents the first stage with up to 5 tissue blocks. Code 17,314 represents stage 2 for up to 5 tissue blocks. The sixth time code 17,315 account for 4 additional blocks from stage 1 and 2 additional blocks from stage 2. So our correct option is option C with the service code 17,313, 17,314 and 17,315 into 6. Mohs surgery is performed on Henry's right arm for an ill-defined skull cancer. Doctor is acting as both the surgeon and the pathologist for this surgery. The surgery consisted of 5 excise specimens prepared and examined during stage 1. A total of 4 excise specimens were prepared and examined during stage 2 and 2 excise specimens were prepared and examined during stage 3. How would you code doctor services? Option A with the service code 17,311, 17,312 into 2. Option B with the service code 17,313, 17,314, 17,315 into 6. Option C with the service code 17,313, 17,314 into 2. Option D with the service code 17,311, 17,312 and 17,315. Our first step is to determine the type of the procedure performed. In the given scenario, Mohs surgery of the right arm consisted of 5 excise specimens during the stage 1, 4 excise specimens during stage 2, and 2 excise specimens during the stage 3. First, we will eliminate the option based on the anatomic site. Since the Mohs surgery was performed on the arm, we will eliminate option A and D. After eliminating option A and D based on the anatomic site, we also eliminate option B because in all stages of the Mohs surgery performed, no single stage has more than 5 blocks. Therefore, we don't need to code 17,350 for any additional blocks. Option C with the service code 17,313 is for the Mohs micrographic technique on the arm and it represents the first stage for up to 5 tissue blocks. Code 17,314 used twice represent stage 2 and stage 3, also up to 5 tissue blocks. So our correct option is option C with the service code 17,313 and 17,314 into 2. Mohs surgery will be performed on 59-year-old that has basal cell carcinoma on the neck. The gross tumor was completely excised. Tissue was divided into 5 tissue blocks, which were mapped and color coded at their margin. Frozen sectioning was performed. A full thickness graft was used to harvest skin from the patient left axially for an area of 5 square centimeter. The appropriate CPT codes are option A with the service code 26,115, 15,260. Option B with the service code 11,600, 15,240. Option C with the service code 17,313, 15,260. Option D with the service code 17,311 and 15,240. The first step is to determine the type of the procedure performed. In the given scenario, Mohs surgery of the neck consisted of 5 tissue blocks prepared and examined during stage 1, and it was repaired with full thickness graft from the left axilla. First, we will eliminate option A and B, as both codes pertain to excision processes. After eliminating option A and B, we will eliminate option based on the anatomic site. Since the Mohs surgery was performed on the neck, we will eliminate option C. Option D with the service code 17311 is for the Mohs micrographic technique on the neck. It represents the first stage with up to 5 tissue blocks. Code 15240 represents a full thickness graft for an area of 20 square centimeter or less, which is used for repair. If repair is performed after Mohs surgery, we should use separate repair codes. So our correct option is option D with the service code 17,311 and 15,240. Sam discovered a lesion on his trunk and was referred to Dr. Ellis, a trained Mohs surgeon, for treatment. Sam had no prior pathology for this lesion. Therefore, Dr. Ellis completed a diagnostic skin biopsy with frozen section prior to the surgery. After reviewing the biopsy result, Dr. Ellis took the patient to the procedure suite and performed Mohs surgery on the same day. Dr. Ellis' final report indicated the procedure required 3 stages, including 5 tissue blocks in each stage. He had to take an additional 4 blocks in stage 2 to verify margins and cell structure. Which course should Dr. Ellis report for this entire encounter? Option A with the service code 17,313, 17,340 into 2, 17,315 into 4, 11,100 along with modifier 59, 88,331 along with modifier 59. Option B with the service code 17,313, 17,314 into 2, 17,315 along with modifier 59. Option C with the service code 17,311, 17,312 into 2, 17,315. Option D with the service code 17,311, 17,312 into 4, 17,315 into modifier 59, 11,101 along with modifier 51, 88,331 along with modifier 51. Our first step is to determine the type of the procedure performed. In the given scenario, Mohs surgeon performed a diagnostic skin biopsy with the frozen section prior to Mohs surgery on the lesion of the trunk. And the Mohs surgery consisted of 3 stages with 5 tissue blocks in each stage and an additional 4 blocks in stage 2. First, we will eliminate the option based on anatomic position. Since the Mohs surgery was performed on the trunk, we will eliminate the option C and D. After eliminating option C and D based on anatomic site, we also eliminate option B because we cannot use the modifier 59 with an add-on code as indicated in date option. In option A, service code 17,313 is for the Mohs micrographic technique on the trunk, and it represents the first stage with up to 5 tissue blocks. 2 times code 17,314 represents stage 2 and stage 3, each for up to 5 tissue blocks. 4 times code 17,315 is for 4 additional blocks of stage 2. Furthermore, codes 11,100 and 88,331, both with modifier 59, indicate a diagnostic skin biopsy with the frozen section performed prior to the surgery, distinguishing it from the subsequent definitive surgical procedure of the Mohs surgery. So, correct option is option A with the service code 17,313, 17,314 into 2, 17,315 into 4, 11,100 along with modifier 59 and 88,331 along with modifier 59. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.